The Ebola virus disease, formerly known as Ebola hemorrhagic fever, is a severe and usually a fatal illness in humans.
Few months ago, the disease was reported to be ravaging some West African countries like New Guinea, Sierra Leone, and Liberia. A patient with the virus, 40-year-old Patrick Sawyer from Liberia, was however announced by the Lagos State government to have arrived in Nigeria last week and later died in a private hospital in the state.
And based on this, the patient was admitted and detained on suspicion of possible Ebola virus infection, while blood samples were collected for testing, and this was initiated with samples sent to the Virology Reference Laboratory at Lagos University Teaching Hospital in Idiaraba.
The news media became awash with the news, but how informed were the people about the disease?
Have you heard anything about Ebola disease?
Ebola disease? No, I've not even heard about it.
Actually, I don't really know anything about it, but I've been hearing about it.
According to the news, they said it's even tougher than AIDS.
When if you bless water, drink it, people believe on it.
So you think that can cure Ebola?
Well, it can cure by the grace of God.
Medical experts have, however, said observing necessary precautions will be more essential than panicking. They also noted that healthcare workers needed to be protected through provision of necessary facilities in the public hospitals.
Apart from knowing the route by which this disease is spread, we must also know what precaution we need to take. So basically, number one is that we have to avoid all these practices that can transmit this virus. So stay away from eating bushmeat and avoid undue contact with people who you are suspecting have this disease. Now, number one, the most important thing is hygiene, hand washing. You must wash your hand regularly. So this personal protective equipment should be made available in large numbers so that all the workers that are working in the hospital will be able to protect themselves from this virus.
So far, the government said all those who had contact with the dead patient had been quarantined.
The intervention so far made as a team include one, the coordination. The NCDC, Federal Ministry of Health, in collaboration with our officials of the Lagos State Ministry of Health and WHO, we established an incident command center that coordinates rapid response team activities on the field. 5 working groups have been established, namely contact tracing, surveillance and laboratory. 2, health education and social mobilization. 3, case management and infection prevention and control. 4, logistics, and the 5th one, data management.
Prevention, they say, is better than cure, as so far no known cure or vaccine is available for people or animals with the virus. In Lagos, Jesuta Moses, NTA News.